Good morning, everybody. I'm Muriel Bowser. I'm the Mayor of Washington, D.C. Today, I am providing an update to the residents of the District of Columbia about the district's COVID response, specifically with very important essential activities in D.C. government. I'm joined today by members of my cabinet, Dr. LaQuandra Nesbitt, who is the Director of D.C. Health, Dr. Christopher Rodriguez, who is the Director of the district's Department of Homeland Security, Deputy Mayor Paul Kine, who is the district's Deputy Mayor for Education, Chancellor Louis Farabee, who is the Chancellor of District of Columbia Public Schools, Director Hunter, Delano Hunter, who is the Director of the district's Department of Parks and Recreation, and Director Chris Geldhart, who is the Director of the district's Department of Public Works, and the Operations Lead at HCMA for this emergency response. We are going to provide a slightly longer update than usual and to share some of our latest information. Today, the district announced 14 new cases of COVID-19 in our community, and fortunately, no additional lives lost. We are showing our updated dashboard, which demonstrates the level of community spread and our process towards containing COVID, our health system capacity, our public health system capacity, as well as community engagement, which particularly focuses on how well we can reach residents who are COVID positive, as well as receive from them their list of close contacts. So we continue to work on all of those. All of those numbers are very important to how we contain the virus. Last week, we spent a good amount of time talking about how to increase community engagement around contact tracing. And on Friday, DC Health began using a new tool that makes it even easier for residents to share their symptoms and health updates with the contact tracing team. I'm going to ask Dr. Nesbitt to review DC COVID Link.
Thank you, Madam Mayor. As Mayor Bowser has mentioned, this past Friday, we launched a new tool in our toolkit for communicating with positive cases and close contacts of positive cases called DC COVID Link. This tool is a new optional service for both cases as well as close contacts of cases that enhances our ability to conduct what is called public health monitoring. This text messaging system allows us to communicate daily with positive cases and contacts to find out if there's been any change in their symptoms, and it's particularly useful for those close contacts. It allows us to encourage them to get the testing that we recommend occur around the third to fifth day of their quarantine. It reminds them of the requirements for both quarantine and isolation. They're able to communicate back to us during the quarantine and isolation period if they're having challenges isolating or quarantining, and allows us to connect them with services that will increase the likelihood that they will quarantine and isolate successfully. It allows us to successfully in their quarantine and isolation, in particular for someone who is a close contact and is in quarantine if they do not develop any symptoms during quarantine. Similarly, if someone develops symptoms during quarantine, we escalate them to be more engaged during public health monitoring, as well as directing them to the appropriate healthcare resources. So again, it's just another useful tool and resource that we have. People have been delighted to opt into this service. About 50% of individuals who are identified as cases or close contacts. It increases the amount of touch points that they have, allows us to collect even more information in an analytics way. And again, the tool went live Friday, so we'll continue to provide updates on its usefulness and the ability to get more people into testing who are close contacts as a result of its launch. Thank you, Madam Mayor.
Thank you, Dr. Nesbitt. I also want to highlight another initiative that DC Health has been working on, and that is flu vaccinations provided at our F Street location. We have spent a good amount of time talking about how important it is that everyone over the age of 6 months gets a flu vaccine. So now through the end of October, Walgreens will be a testing partner with us, and they will provide flu vaccinations between 8 a.m. and noon through the end of October. And we would like to remind everybody to to bring your ID as well as your insurance card when you're going to the Walgreens table for your flu shot. Residents without insurance can find flu vaccine locations at dchealth.dc.gov/flu. I want to now turn to share a little bit more about our planning for in-person learning. We expect to make a more comprehensive announcement next week, but we do have a few things to share today. I'm first going to start by handing it over to Deputy Mayor Kine to talk about some lessons that, some initial feedback that we've gotten from schools in DC that are already offering in-person learning. You probably remember me saying in the early part of this month that we would check in with schools to see what they're finding so far. And then we will hear from the Chancellor about some limited in-person experiences that start today. And Director Geldhart will speak about our facilities planning. So Deputy Mayor Kine.
Thank you very much, Mayor Bowser. I'm really excited today to talk a little bit about some of the things we've been learning from the schools that we've interacted with who have actually been open and providing in-person learning experiences for families. This was a very initial, and I'll describe it as a quick overview. We conducted interviews with 18 schools. We did promise them confidentiality, so I'm not able to share with you the names of those schools, but there were 11 private and parochial schools and 7 public charter schools that were offering a range of in-person experiences, from most of their students being back in the buildings learning in cohorts to the schools bringing in small cohorts of students that needed to be in person the most. In all cases, I want to just confirm that these were all schools that were following DC Health and OSSI guidance on in-person learning in terms of the health protocols that need to be in place. We did talk extensively about the work with teachers in terms of ensuring that teachers felt confident being back in the buildings and the buildings were safe. And what we learned from these schools was that the visible transformations of the schools went a long way in terms of signage and the way in which classrooms were set up. Teachers also reported feeling safer when the leadership of the schools responded to feedback that they had to offer, and if they were able, in some instances, to take their students outdoors for breaks. And also what became clear to schools was that over time, teachers' anxiety really lessened once they were back in the buildings with students and following the protocols and seeing that everything worked. We also talked about what it took to build confidence amongst families that their students would be safe, and here communication was key. They needed to understand the new processes and procedures, and the schools all advised that schools communicate early and often with families. Families also need to see what the schools will look like, and they need to see that the protocols are implemented with fidelity. They like to see staff members redirecting students and seeing students actually following the health guidelines. We were also told by schools that families, of course, will congregate if given the chance, and so schools need to be ready to ensure proper movement and flow of families as they're coming into and out of the buildings. And lastly, on families, many of the schools developed agreements or covenants that they encouraged families to sign so that everyone understood what the protocols were. On some of the operational guidance we got from these schools that were open, it did transpire that students really needed time to practice, so repetition was really important for students as they move through the building and as they get used to the routines in the classrooms. In terms of face masks, excuse me, it turned out that most schools suggested that students had no problem whatsoever wearing the masks. There were some common challenges, for example, after lunches, just reminding students to put them back on, and students allowing the masks to drop below their nose. Those kinds of things schools reported they had to work on, but otherwise, the mask wearing seemed to be not an issue. And then in terms of just ensuring proper hygiene practices, some schools created student boxes that they would distribute to students in the morning with everything they needed for the day for their health protocols. And also, schools were careful to remind us that you've got to assign students and staff to everything that they might interact with over the course of a day, including entrances, hallways, bathrooms, and so on. In terms of arrival and dismissal, staggering was actually important for some of these schools, and it can be very helpful if schools are able to do that. Entry and exit areas do need to be big enough to allow spacing, and as I mentioned, discourage the kind of congregation that can occur. Practice, practice, practice was a common theme, as I mentioned earlier, and of course, ongoing communication with families before the first day about what to expect and what the procedures will be was very important. On the daily health screenings, some of the schools did use web-based applications for families to report before they arrived what the temperatures were and whether their students were feeling well. So if possible, that was considered to be good practice by some of these schools. And lastly on this, temperature checks, while not required by DC Health, were seen by some of these schools as a way to build the confidence amongst their workforce, teachers, staff, as well as some families who felt more secure if temperatures were being checked. So that was one other idea that came from this. I'll conclude by simply offering the observation from these interviews that schools also suggested that demand amongst family does grow once you start. So as families see this working and as teachers see this working and as they begin to feel safe, demand does grow. So these schools encouraged us to consider planning for that kind of growth. And with that, Mayor, I'll turn it back to you.
Thank you, Deputy Mayor Kine. And Chancellor, if you will, talk about what DCPS is doing prior to the start of term 2.
Thank you, Mayor. Starting this week, DC Public Schools is proud to welcome students back on our campuses. As select DCPS schools beginning this week, starting Blue State High School, and throughout the month of October, we'll be providing services to students via our Student Services Support Centers and also through our career and technical education programming. The Student Support Center opportunities include social emotional learning, academic support, and other targeted supports for students, including physical education and related arts. Again, we're excited to welcome students back to Ballou High School today, and you can see on the slide the other elementary and secondary schools that will be inviting students back on campus throughout the month of October and beginning in this week in term 1. On the next slide, we highlight some of our work and upgrades that are in process for our HVAC systems. We continue to evaluate and prioritize the conditions for in-person learning throughout our elementary schools, knowing that our earliest learners have been prioritized for academic and social emotional support. On the slide, you can see the numbers for the work that is taking place and what is needed to be done to ensure that our campuses are prepared to receive students. We have 80 elementary schools and we have 17 contractors that are now working on our HVAC systems. And of our 80 elementary schools, 24 have HVAC work orders that are currently open. Of those 24, 2 of those are impacting the entire building, and 2 of those are impacting about half of the building, and the remaining 22 are impacting only a few classrooms or a few spaces. And so we'll continue this work and ensure that our buildings are appropriate for in-person learning for our students.
Thank you, Chancellor. Director Geldhart.
I have actually nothing else to add on to what the
Please.
Chancellor had, except
HVAC.
to say that we're working on all the work orders, not just the HVAC, but all the other things that we have in the facilities as well, so that our schools are ready when we're ready to bring students back.
Thank you. And Director, let's see where we are. Director Geldhart would also talk about our distribution for meals throughout the city.
Thank you, Madam Mayor. The grocery distribution sites that we've had throughout the city, we were doing 2 sites per day across our week to distribute groceries. Through that, we have found that many of our community-based organizations can better reach some of the folks that were receiving groceries in those sites, and we have since starting on Monday this week gone down to a single site per day across the city. The schedule is out. It's on coronavirus.dc.gov as well as here on your screen. We are out at all of the additional sites that we were providing meals at prior to today with pamphlets and folks that can work with folks that are still coming to those sites to ensure people know how to get assistance when they need it, and that can be through any of the many programs that the district has to provide assistance to folks such as SNAP and TANF, as well as where community-based organizations are that will still be distributing food.
Thank you, Chris.
Yes, ma'am.
I also wanted to talk a little bit about our Department of Parks and Recreation, and Director Hunter will talk about what DPR is doing in more detail. But I'm not sure that everyone recognized that our DPR staff was out this summer and stepped up to offer in-person activities through fun and sun camps, as well as learning hubs. So we wanted to share a little bit of information about that. But over 1,100 young people were able to have some sort of in-person experience for summer camp with the support of 500 of our DPR staff members. And importantly, there were no known COVID cases traced back to those programs. And now we're happy to share that DPR will again offer limited fall programming to DC residents. So Delano, would you walk us through what DPR is doing?
Thank you, Mayor Bowser. The DPR team is excited to safely return to recreation, and I'll go over our Phase 2 fall offerings. After providing a great summer camp experience, we are excited to build upon that success to offer programs which will include outdoor fitness classes like yoga, Zumba, and gardening, sports like tennis and pickleball, as well as activities for our seniors. Additionally, we will offer learning hubs at 6 locations, cooperative play, field permits for limited athletic activities, and our grab-and-go meal service that does not require registration. So I want to point out that our registration for fall programming will open on Thursday, October 1st at dpr.dc.gov. And our programs will start on a rolling basis on Tuesday, October 13th. So you register on October 1st. The programs will start on October 13th. And we're really excited about the bevy of classes that we are offering. For our fall program offering, DPR will open 29 recreation centers, including 19 fitness centers, 7 indoor aquatic centers, and 6 learning hubs. With guidance from DC Health, we have implemented comprehensive health and safety protocols for the protection of our patrons, and these will include a strict mask requirement. All program participants are required to comply with the mayor's mask mandate at DPR facilities. We have also partnered with the Department of General Services to ensure enhanced cleaning at recreation centers and pools. This means that high-touch surfaces, such as gym equipment, will be cleaned after every use. And to facilitate our elevated cleaning regimen, users of our pools and fitness centers must make reservations for a specific time slot. And between each time slot, our clean teams will wipe down surfaces. As part of our safety measures, pool and fitness center locker rooms will not be open for use. Additionally, access to DPR facilities will be limited to program participants who are pre-registered or have reservations, and all participants will be required to provide a photo ID. This is just a list of our indoor swimming pools. So we'll actually get to 7 by December. We're going to start with 6, Marie, Reed, Wilson, Tacoma, Turkey Thicket, Rumsey, and Berry Farm. The Deanwood HVAC is being completed, and we anticipate offering that pool service beginning in December of 2020. Pool reservations will be 45 minutes, and they will start at 6 a.m. to 12 p.m. We'll close at 12 for cleaning and in-service training to 4, and then evening permits will start from 4 p.m. With the last permit schedule or block ending at 8 p.m. And again, those registrations, we will accept registrations starting on the 1st at dpr.dc.gov, and those fitness center and those pool center hours will start on October 13th. Last but not least, field permits. We will be issuing a limited number of athletic permits for moderate contact sports practices and low contact sports games. I just want to emphasize that all organized athletic activities require a permit, and though that permit window will open up on October 1st, and those permits will begin on October 13th. Thank you, Mayor.
Thank you. That's a lot, DPR. Thank you, and I want to thank the entire staff at DPR for all that they have been doing to support learning and now bringing back a lot of recreational opportunities. So, and let me also close out by making a few more general, though substantial, observations as well. Friday, we announced a live entertainment pilot that will allow a limited number of venues to offer live entertainment indoors and outdoors while we carefully monitor their activities and learn from their experiences. We, at the beginning of phase 1, we also had a pilot for retail, which was very helpful to us in sharing the experience with other retailers before they were allowed to open. We invited 6 venues to participate in the pilot for indoor entertainment: City Winery, Gala Hispanic Theater, the Hamilton, the Kennedy Center, Pearl Street Warehouse, and Union Stage. We also invited 8 organizations that had already submitted a waiver request for outdoor entertainment to submit a detailed plan. So at this time, we're only accepting plans and waiver applications from those invited venues, and the pilot period will run through October 30th. We also have an announcement related to our fall leaf collection, which will begin in early November, and I will hand it over to Director Geldhart to talk more about that.
Thank you, Mayor Bowser. DPW, as we do every year, is excited to do.
Hold up. Before you start, I should say this. Our DPW team has been outstanding.
Thank you.
And I'm reminded, because my trash and recycling gets picked up on Mondays, that they're always there and have been doing the job throughout this pandemic without hesitation or pause. So please share my appreciation to the team.
Yes, ma'am. Thank you. As we do every year, we are excited to do the leaf collection in the city. However, given the pandemic, there are some limitations in which that we were going to need to put in place for our leaf season. And that change will be, we will maintain the current schedule of collecting leaves, just as it was last year. However, we are going to ask residents this year to bag leaves. The purpose for that is we have over 350 DPW employees that do leaf collection, and we cannot do it the way we've done in the past by putting 30-person crews out every day. The social distancing just does not work to do it that way, so we'll be asking residents to bag their leaves and put them in front of their houses, in the tree boxes and areas that line the front of the houses, so that we can collect them instead of through vacuuming with larger garbage trucks. So we'll be running smaller crews in garbage trucks to pick up leaves. We will be reaching out to all of our disability collection points, all of the folks that have a disability to talk with them about how we can assist in bagging of the leaves. So We will be handing out 20 bags for every DPW collection point in the city to start off, but we will not limit collections to 20 bags. We will hand out 20 bags to every collection point, but we will collect unlimited amount of bags. Whatever is out in front, we will collect. That's the major change for this year, but just to remind folks that the schedule stays the same, and we ask you to have your leaves out the Sunday before the Monday of your week for collection.
And it's paper bags.
Paper bags, yes, ma'am.
Okay. And finally, thank you, Chris. 2020 census, again, you need to take it by Wednesday, September the 30th. And you may have heard that a federal judge has ordered the count to continue through October. However, we know that there's also an appeal ongoing. So let's not risk it and respond to the census by this Wednesday, September 30th. Get counted at 2020census.gov. And you may also call the 844 numbers that you see to respond in English and Spanish. So with that, our report is done, and we will take a few questions. Sam?
Yes, Mayor. Just a quick, Mr. Geldar, you mean every house is going to get 20 bags, or how does this work?
Every DPW collection point, so if we collect your trash, we will be delivering you 20 bags for the leaf season. That's two.
Every resident will get 20 bags.
Every collection point that we collect from, we will give 20 bags. There are two, we do a 2-cycle, so we come through in November, starting November 9th, we'll start the schedule. We hit all of the residences throughout the month of November and into December, and then there's a week break, and then we do the second pass on collections, and we're going to hand out 20 bags in the very beginning of that for the entire leaf season collection.
Any other questions? Yes, can you introduce yourself?
Yeah, Debbie Trung with WAMU. How many students total will be returning to classrooms over the next several weeks, and how were they identified?
How many in I'll ask the chancellor to respond.
So the size of students that will be served via our student support centers will vary by school. On average, they'll serve about anywhere from 20 to 50 students a day, and the overall program could be anywhere between 20 to 100 students. We'll have a slate of schools that will start this week, and then we have some schools that will start next week, and then throughout the month of October, the remaining schools will open for students.
Yes, Perry.
How many, following up on Debbie's question, how many teachers will be used to staff those students? And did you work with the union to come up with this plan?
So again, all of the staffing plans will vary by schools and the type of support that will be provided. We have worked with the Washington Teacher Union on the status of our student support centers as it relates to staff volunteering. This is a volunteer opportunity for students, and then staff that are participating have volunteered to provide in-person services to students.
So we have 13 plans that were submitted. So this suggests that a lot of principals did not feel comfortable submitting plans. Do you have concern that principals will not be ready come November, since so few submitted plans this time around for October?
So I would say that this actually represents great interest from our principals, and they have been the ones that have actually spearheaded their efforts at their school levels for the student support centers. This will be an ongoing effort. We have had schools express interest since our initial application period. There are many schools, for example, that are exploring a number of different options, including outside learning as well. So I anticipate as time goes on, there'll be more schools that will take on this effort as we plan towards term 2, and then we'll provide updates in the future, as Mayor Bowser indicated, as it relates to the overall DCPS plans for the future.
Yes, Mark?
Okay, so if we can just stay on this topic, Chancellor. So one of the things you said was about prioritizing early learners going back first. I think you said elementary schools were the first schools. So does that mean come November 9th, when you're targeted to go back to classes, that you're targeting getting elementary school students in first before middle or high school students, or what did you mean by that?
Yeah, so prioritizing our earliest learners have always been a part of our planning for in-person learning. You recall back to our summer planning for hybrid learning and in-person experiences. There was more time for our elementary age students who are pre-K through 5th grade. We anticipate that prioritization will continue, which is one of the reasons why we have prioritized our elementary buildings for our HVAC work and any other work orders that need to be completed for operations.
And so then these schools that are on this list that have opened today or over the next week or two, does that mean that these facilities that are on this list here, Ballou, Bancroft through Roosevelt, are all quote unquote COVID ready or have been, looked over by Mr. Gilhart's team and assessed and brought up to whatever?
That is correct. So there is a operational and safety review of each school student support center plan before a school move forward with implementation of their supports, which is one of the reasons why there's a staggered opening to our student support centers, because there is time needed for that review process.
And so that means these schools have gone through that process and are ready to go, or will be ready to go by the date that they start accepting students?
That is correct. So for Ballou State, that is opening today, receiving students, they've completed that process, and any other schools that were open will also complete a similar process.
And so you say programs and support services, so what's happening now and over the next few weeks are not classes, is that correct? It would not be, it's other peripheral tutoring and support services?
So every student that is currently learning at home remotely, those classes will continue. However, there are targeted supports that can be provided through the student support centers, academic supports for students, social emotional support for students, and as noted in the Ballou State model, we're also operating with our career and technical education programming to allow students to complete the in-person hours for their certifications that they're working towards.
Thank you.
Just to clarify for a second on that as well, Mark, to your question, the operational and safety plans and the things needed in the facilities for a small 20-person cohort or less is much different than when you're opening an entire school to students to come in. So the plans and the things that were put in place for those centers are geared around that size of a population. The things needed for the rest of the opening of schools and the much more students to come in are much more granular and much larger improvements.
So for instance, in Ballou, you may have just focused on the rooms or whatever needed to conduct the cosmetology and whatever that they're opening up, not the entire campus.
That's correct.
Okay.
Yes, Sam?
Chancellor, so no instruction is going to happen in these schools? Is that what you're saying?
Yes, instruction can happen. I just want to be clear that it is not replacing their classes that they're currently enrolled in that they're learning remotely. So they will continue their classes that they're currently enrolled in at this time. However, the student support centers are designed to provide additional support for students. Academically, again, social and emotionally, could be physical education, other supports for students, and again, as I mentioned earlier, career and technical education.
And all the teachers are volunteers, is that what you also?
That is correct.
So no one should complain that they didn't want to go back. If they're there, they volunteered to go back.
Those are your words, Sam.
I'm asking.
But yes, everyone who is providing service is volunteered to do so.
Yes.
Two questions. My first, so for Ballou today, are the teachers there? Are they all like Ballou teachers? And also, how many students are there today?
So it will vary in a number of students that are on campus each day. For the Ballou model, it will range anywhere from 20 to about 50 students a day. And their total model serves about 60 to 70 students in this first week. That number could expand. The teachers that are currently serving the students there are teachers that were employed at Ballou State.
high school.
And then my second question is about the hybrid plan. So I know that some epidemiologists have warned that the hybrid plan might not be the safest just because it could introduce more contacts the days, like for instance, if a family needs childcare, and then that you're exposing more families or the school to additional contacts through like the daycare staff and the new students. And so I wonder if you share those concerns, and if so, how you plan on addressing them.
We'll talk a little bit more about how DCPS will start the term 2 in a more fulsome update later.
Like next week.
Yeah, yes.
Speaking of which, do you think that DCPS can start on a hybrid model or start for in-person learning come November if Prince George's County does not open?
I do, yes.
You do? Was that?
Yes.
So if there's like a coronavirus case at any of these support centers, or if there's an outbreak, at what point would the city decide that it's time to quarantine students or to close the school?
Do you want to, who wants to talk about how cases are handled at the public schools?
So I'm sure you know that, and the mayor talked about this, and Director Hunter operated a summer camp environment with adults as supervisors and children as attendees, over 1,100 children as attendees. And so we've worked very closely with all of the entities in the education cluster for them to have plans in terms of whether or not a student presents with symptoms or contacts the entity to say that they have been diagnosed, or an adult who works in that environment. The reason why we talk about cohorting as a structured plan, or the reason why we require that these plans be in place, is to be able to identify who the close contacts are, to recommend quarantining for close contacts, and eliminating the necessity for closing the entire environment. So there is a way to identify the close contacts, recommend quarantining for both the student learners and the adults, and continue to operate that environment. The operations team in the Emergency Operations Center has worked with the Department of General Services and the school system, as well as Parks and Recreation, to put together their very detailed cleaning plans as part of their operational plans, such that we can respond to cases and contacts being in their environment and maintain operations for as long as possible. If there are multiple cases identified with, or we see a cluster, then that triggers another level of activity. There is no specific number that is identified and given to them in advance as part of the investigation.
Okay. Anything else?
Oh, yes.
Yes.
Director Hunter, just quickly on the pools and the rec centers, are those going to be open only to DC residents?
Our priority is to serve district residents, and we fully expect that once we offer our registration portal, which will be to district residents first and foremost, that those will be completely sold out.
And the same question for the fields. I know with a lot of the fields, a lot of the groups that get those fields, not all of them, I don't know the percentage, are not organized or run by DC-based groups. So the same question, would those fields and outdoor opportunities go first priority to DC-based groups?
Our permitting structure is governed by a use of permits regulation, which is DC law, which we strictly adhere to. And there is a priority ranking, which includes those that serve district youth, those that are based in the district, our schools and charter schools. So we'll continue to follow that protocol as we would do in any normal circumstance.
Yes, Perry.
And two questions. One is for the entertainment pilot program. How did you choose which venues got to participate? And to Dr. Nesbitt, you mentioned what schools, will do if someone becomes infected. Is there a protocol to how you will announce this to the public, or do you plan to announce any cases to the public that occur at schools?
I think also, Perry, when we talk next week, this is a topic, going back to the earlier question, that we know that teachers and families want a complete understanding of how it works. And so when we talk about our schedule for November the 9th, we want to have sample language that they will receive in the event, if there is an event of a case at their school, and it will be all outlined. And what was your second?
The pilot program, how did you choose which venue?
As you know, Homeland Security and Dr. Rodriguez and his team are responsible for our waiver process. And earlier, I think in July, we announced that people could submit waiver requests, and those were among the ones that we checked. We were also very interested, and I'll ask Chris to talk to the process that he and team went through to go through those waivers to see if we could get a representative pilot group that could inform how we opened up further venues.
Thank you, Mayor Bowser. So for the indoor venues and in working with DC Health and looking at risk levels for live entertainment as we began, or as we are instituting this pilot, indoor venues are not surprisingly more risky. And so we looked at larger indoor venues to begin this pilot program and to invite those venues to resubmit plans based on new guidance, which is on coronavirus.dc.gov. For the outdoor venues, those 8 are ones that had previously applied for a waiver, and we are now inviting them back to resubmit their plans based on that new guidance.
Thank you.
Yes.
Advocates for the live music community think that the pilot program means that you won't provide any more targeted relief for them. I wonder, is that true? And also, what are your thoughts on the Music Venue Relief Act, which would provide monthly financial assistance?
I don't know that I'm familiar with that. Was that passed by the council?
It hasn't passed. It's been, this is what advocates are calling for. They're calling essentially for monthly financial assistance to live venues.
I certainly understand that sentiment. We know that these venues were shut down earliest, all of our large venues, not just for live entertainment, and they will likely be most impacted as a safe reopening happens. So I certainly understand that that sentiment, and that our businesses that fall in that category, I call it first impacted, last back, should get our serious consideration when and if we're able to provide more local support. We continue to be very focused on the federal government doing its part in making sure that those stimulus funds that come back to us, that are still in talks, as you know, but that would go a long way in terms of the district being able to consider additional local support. I think you know we have already committed $33 million in local support, and we've also added, and I'm so pleased about the response so far to the additional winterizing streetery grants that we will make, and we will continue to look for ways to help our businesses come back. Yes.
Can I follow up on this thread? And have any of the venues responded yet to your call for an updated report or updated plan?
I'll ask Chris to do that, but as you know, this just happened on Friday, and I think Chris has had some initial feedback, and Director Rodriguez, if you would.
So we've heard from several venues, if you add them all up, about 14 venues there. We've heard from about half of them, mostly thankful for the opportunity to resubmit plans. There are some questions based on the individual venues, which we will address with them directly.
And the guidelines, is it 50 for indoor and outdoor?
Yes.
And so it's 50 that includes staff, band, and patrons, is that right?
That is correct.
So the venues that I've talked to, you know, if you get a one-man band and a bartender, waiter, managers, I mean, you're really looking at only having maybe less than 40 paying customers coming in. And they say that that's just not feasible, that it's just, that they need to be able to have more people. These venues can hold, I think the smallest one on your list is Pearl Street, which can hold 250.
So I would respond in two ways to that, Mark. I think the first is we have to remember this is a pilot, and as we reopen live entertainment, we want to do so in the safest way possible, consistent with public health guidelines, not only from the DC Department of Health, but also national guidelines as well. The second is that we are working to address a lot of the questions that these venues have about the guidelines. And so, as I mentioned, we will address them directly with those venues.
And then can I ask about, I think you say you based a lot of your decisions here on the waivers that were submitted during phase 1. In the beginning, you published, Mayor Bowser, you published that list of everybody that was, it was a public record on your dashboard. Here are the businesses that have submitted waiver applications. And then you stopped publishing that. I've requested now through your administration's FOIA office for months, just the list of the waivers, applications that have been sitting on somebody's desk for months that you're clearly using. And not only have you not released it, your FOIA office hasn't even replied. And so I'm just wondering if I ask you, in the interest of transparency and to the question of how these venues were chosen, would you release all of the waiver applications that you guys have received so far?
You're talking about ones that are approved, or?
No, the waiver applications that are just pending, all of the applications that the city received thus far.
Let me check on that, Mark. I'm not sure what we discussed with people when they applied. But if they're approved, and I don't see any reason why.
Approved is not what I'm seeking. I think to the point of
Okay,
transparency.
I will have to ask a little bit more about that, because I'm not sure what we told them when we collected that information.
And while I'm adding to your list of things that
That you want to not be happy about?
So
Okay.
the federal government, under the CARES Act, requires local governments that received money to submit a report. The district government didn't get the 1.2 billion requested, but got $500 million, got $500 million.
Well, something less than that.
But
What-
there's a report that was due, I believe, earlier this week or last week, I guess, to the federal government that shows the expenditures, where that money went. And I'm wondering, did you submit that report, and would you make that report public?
I don't think that we have anything pending with the federal government, Mark, but we'll certainly check. And as we reported in the last couple of weeks, we have submitted, what's the percent of reimbursables that we've already submitted to FEMA that show a detailed accounting of our expenditures?
But as far as releasing the report that you submitted to the government and as required by the CARES Act, would you release that to the public?
Let me check on the report you're talking about.
And I just have one last question.
Yes, sir.
Given that Governor Northam has disclosed publicly that he's tested positive for COVID, I'm just wondering what your protocol is as far as how regularly you get tested. Is that a concern? Do you have a plan in place should you test positive that you're able to continue governing and communicating with your team?
Well, thank you for your concern. I do, and I have from the beginning. And we have as a government from the beginning. And I don't have a regular cadence that I get tested, but I get tested regularly, if that makes sense. I was tested last Monday, for example, when we left one of these briefings. And when I am tested, everybody around me is tested. So my comm staff that you interact with regularly, my scheduling in advance is tested, my detail is tested, and but again, it's not something that we do every Monday, for example, but we do it regularly.
And can I just follow up? Do you go over to F Street and you go through a public place
I've done both. I've done it with my physician, and I've done it in a public site.
And what has your experience been with turnaround time?
It's been excellent. I was there on Monday. I think I got my results on Wednesday.
Thank you.
Thank you. Yes.
We talked about a few weeks ago, you mentioned workforce readiness, and that being one of the factors that plays into whether schools will reopen. I'm curious, Chancellor Farabee, Deputy Mayor, do you have a sense yet of how many teachers will be willing to go back November 9th, and what will happen if they are not? or if not enough are. I know the union last time I spoke to them said something like 150 teachers, but that it was increasing regularly. Worried.
Yeah, so we haven't collected number recently from the Washington Teacher Union. What we have talked about is what our plans would look like as relates to term 2 from a health and safety perspective, and also how we would staff schools. And those, again, are ongoing conversation. And as Mayor Bowser shared earlier, we're preparing for an update as early as next week on some of the details of what term 2 could be for our students and families.
All right, thank you, everybody.